And welcome back to day 2 of our muscular considerations videos. So now we're going to pick up on agonist and antagonist muscles. So what is an agonist? An agonist is a muscle that produces the desired movement. So if I do arm abduction, it is my deltoids, right? So then the antagonist during that motion would be the muscle that opposes that or performs the opposite joint motion. So the muscle that adducts my arms, right? So we're looking at like our latissimus dorsi when we do that. Okay, right here. That guy pulls it down. Boom. Now the antagonist must allow the movement to occur by relaxing. So when I abduct my arm, my latissimus dorsi has to relax enough and say, oh, that's a safe movement for them to do. I can do that. We're not being thrown out of position. I wasn't hit and my body needs to slow my arm down to do that. It doesn't need to control that. It just needs to allow the motion to happen. Now, it may also actively participate in decelerating the joint. So like when I'm throwing a baseball, it's externally rotate and come across here. But my posterior muscles, where I have multiple muscles in activation as I'm coming across throwing a baseball like that, right? But the posterior chain back here, they need to work as they elongate and let that motion happen. They also need to perform a eccentric contraction to slow down the entire movement of that arm as it's going forward so that I don't sustain injury. Okay, the most susceptible injury is to the antagonist muscle because of the fact that it is typically providing that eccentric contraction while being stretched, which we discussed earlier in the first video. That is the most common way for us to actually get injured in the muscle tissue. And then as we look at joints and muscles as they interact, we have stabilizers and neutralizers. Stabilizers stabilize the joints so that motion can occur and the force is redirected to the desired position. So that's like when we talked about our shoulder earlier in our shoulder anatomy. The stabilizers are the ones that hold that posterior, as I was showing you on the anatomy man. The posterior muscles stabilize that joint so that when I bend my elbow, the biceps can direct the force into that adjacent joint, the elbow, and apply that force as we need. The neutralizer is a muscle that works to eliminate the movement of another muscle. Okay, so like the triceps and the biceps, those are both neutralizers to each other. They work to eliminate movement of another muscle. Okay. Then we get to the types of muscle contractions. So muscle contractions, we have isometric, concentric, eccentric muscle contractions. Isometric muscle contractions is when the muscle contracts but the muscle does not actually change length. Typically a cross bridge remains constant through this, and the cross bridge is equal to the amount of force. So we have a very steady amount of force created when we have these cross bridges formed, and the muscle doesn't change length. So you look at the first picture over here on the left, right here, and we see that this is an isometric muscle contraction for the most part. Like if we break it down, it's actually not. But if I was to contract here and let's say put my arm on something level on a table and I push down, right? I'm getting a contraction, but I'm getting no shortening of the muscle because that table is not going to move. I'm not strong enough. I can't create enough force to actually push down and push into the table that it deforms the table and my muscle starts to shorten. So it would just sit here and contract, but it would not change length. That's what an isometric muscle contraction is. A concentric muscle contraction would be when I lift my arm up and my deltoids have to shorten here to lift that up. Okay? So when that happens, that's typically our lowest force output. So that we think of that as our strongest way when we shorten the muscle and we get a nice concentric contraction where we're flexing our biceps. That's actually when we have the lowest force output. The cross bridges decrease as the muscle shortens. Okay, and then we also have to resist gravity, so it's a very inefficient muscle contraction because you're going not only against whatever weight, but you're also having, when you bend your arm, you also have to move against gravity. Okay, and that is why eccentric contractions are the most efficient and the most force output. A muscle contracts and it lengthens at the same time. So to bring my arm down in a slow position, right, my deltoids have to slowly allow that muscle to stretch, allow the joint to come down while still contracting and lengthening at the same time. You can create the same force output as an isometric and concentric with fewer fibers actually being activated. And we also have gravity assisting us as these eccentric contractions typically occur. So, as a clinical pearl, as you move forward, when you think about designing an exercise program for someone who is significantly deconditioned, you may want to start actually with an eccentric strengthening program and then move on to an isometric and then move to a concentric program, because when we're working with the eccentric program, we have gravity assisting us, we have fewer fibers being activated, so we can get the same amount of force output with fewer fibers, so we can kind of build them into that program. With the isometric, we're not losing any force throughout that muscle motion, so now that I can do it with gravity's help, now can I just hold it here and squeeze my muscle strong, and now I'm having an isometric contraction and I'm not getting any shortening, so I'm also not working as hard, so it's like that second tier. And then as you progress to there and they can just hold their arm, now you go on to your concentric where you're fighting gravity and whatever desired weight you're trying to do or resistance you're trying to do, to really work that third level of the muscle contraction. Then we move on to one versus two joint muscles. In one joint muscles, this is what most muscles actually fall into in terms of categorization by how many joints they cross. Most only cross one joint. And the action is at the joint it crosses. So if I have something that crosses my knee, it's going to do something to the knee, whether it's in the anterior, the posterior, the medial, the lateral, depending on the position of that muscle crossing the joint. That's where you actually start to see, you understand that that's where the muscle action is actually going to occur. In two joint muscles, they create multiple movements, and these movements are often occur in opposite sequences. Okay, so you may have hip extension or hip flexion and knee extension at the same time, like those types of things. The joint action depends on the body position, so depending on how my body is actually positioned, you can see that different things are going to happen. And its biggest factor of a two joint muscle, the most important aspect of that is that they reduce the work of one joint muscles. So if you look at your picture over here on the left, you see that the rectus femoris, it works primarily as a knee extensor, even though it does cross the hip joint. So it crosses the hip joint and the knee joint, and it's most effective at knee extension. Why is that? Well, you look at the tendon aspect, and that's down here, right? We have a big kind of aponeurosis up here as it creates that bipinnate muscle fiber, right? But you look, most of the belly of the muscle is down at the distal end, right? So that makes it much more effective at knee extension than it is at hip extension or even hip flexion. So then the hamstrings in the back of the leg, those are much more effective at hip extension, right? Because most of the muscle belly is up top and you lose that down here. Okay, so you don't have the aponeurosis here. So you have the biggest cross section of that muscle at the top, thus allowing it to really be effective as a hip extensor. So now let's go ahead and let's look at strengthening muscles. Okay, so what's actually happening when we strengthen a muscle? So when we strengthen a muscle, our goal is to achieve the maximum amount of force from each muscle fiber that we're training. Mechanically, what strength is actually is it's the maximum amount of torque that an isometric contraction can put out from a muscle in any given position. Okay, so you got to think like when you stop, when you're doing a 1 rep max or a 5 rep max and you kind of get stuck, that kind of hits your maximum amount of torque that you're able to produce to move that object as far as it can go. And then you end up failing because you aren't able to complete the movement. So we say you don't have that strength, but really it's almost like as you come to that standstill, that's the max amount of torque that you're able to produce, and that's where your kind of definition of strength comes from. Usually we measure your strength by moving some type of external load, so when you think of like a bench press or something like that. And then you have to look at a couple things when we're measuring that. You have to look at the muscle action, the speed of the limb, and a maximum amount of force. So the strength of a muscle is going to be limited by the weakest joint position. So as I move from like a bench press, right, where I'm here, extending my arms, then coming back down into almost a full flexion, you have to realize that that muscle, I may be really strong here, but as soon as I hit the weakest link, which would be that terminal flexion, right, because that's where that dislocating force kind of comes through those elbows, if we remember from our previous discussion, then that's going to be the most limiting position right at the bottom. And that's why you see people fail right after they get down their chest. Eccentrically, we're good as we're able to pull in it down, right? No problem. And then I got to get it from here to here. That's the weakest point of that muscle chain when we're doing that bench press. So that's what happens there. And then, like I said, the speed of the limb. So you got to think what kind of fibers make up that muscle: fast twitch, slow twitch muscle fibers, and then the actions of the muscles that we're trying to train. When we are training must focus on creating hypertrophy, okay? That's what we're looking to do when we're training a muscle. We want to get those muscle fibers stronger. So what happens is hypertrophy is actually where we increase the cross-section of the muscle, which thus leads to larger muscle fibers, which leads to more capillaries, more oxygen, more glucose being delivered to the muscle, and then also ultimately we get a greater fiber area. So the fibers actually increase in size, and that's how we actually get the larger mass and cross-section of that muscle. At a cellular level, what we're seeing is those myofibrils, they grow and then they split and they become two. And a lot of your early gains in strength training is actually from a neurological adaptation where the actin and myosin and you're getting more cross-bridging between the neurological motor units as they're recruiting more fibers to perform this action that you're asking them to do. As you're training them, you're not only training the muscle, you're training the motor units and the neurological system. So over here on the left, you see that like pre-training, it's showing these muscle fibers here, and you see the myofibrils, which are just the little blue little strings here. But you see how the myofibril splits, it grows, so it starts at the top here and it starts here. Post-training, it swells up. Then down here you see these, it's almost already starting to split, and then it grows and it splits off. So now I have more myofibrils, so I can get more motor unit recruitment. Now you can see down here in B what they say. This hasn't been proven in humans, that's why I didn't really mention it, but they're saying that some hypothesize that not only the myofibrils split, but that the actual muscle fibers will split. So that's how you kind of hear sometimes they say, you can gain more muscle fibers by getting more muscle mass, but it hasn't been seen in the lab in humans yet, so that's still to be proven. So then lastly, we're going to close up by talking about injuries to muscle. So a lot of times an injury to muscle is defined as either pain, DOMS, which is delayed onset muscle soreness, swelling, anatomical deformity, so I could rip my muscle and then I have a divot in my arm, or I avulse the tendon from the bone and it rolls up in my arm or my quad, or I get a lack of muscle function. So a lot of times anatomical deformity and lack of muscle function, or lack of function in general, they kind of go together along with the pain and swelling after that. So Muscles that are at the highest risk of a strain, which is what a muscular injury is or a tendon injury is, right? Because they do have a contractile ability. So we say it's a strain because when we put a load under a muscle or muscle under load, we are straining that, right? We're putting putting tension or a force through that muscle fiber or that tendon or ligament fiber, and we're pushing and we're causing a strain on those fibers. So the muscles at highest risk are two joint muscles because they can be stretched from two joints. So if you think of yourself like going to kick a soccer ball, you're extending your hip. If we're thinking of the quad, right, the rectus femoris, you're extending your hip, which puts it at stretch up at the superior portion, and then you're bending your knee, which puts you at a stretch at the distal portion at the same time. So you're stretching both ends there. Muscles that limit range of motion, so muscles used to slow a fast moving object. So once I kick the ball, right, if I'm revving back to kick a soccer ball, once I actually kick it, what happens is my hamstrings fire and contract to try and slow that down. And that's a lot of mass and it's moving pretty quickly. So that's where you can kind of get some injury to that. And then muscles eccentrically contracting, so the muscles remain weaker or sore longer after an eccentric exercise, and then short rests and longer muscle weakness. Um, yeah. So, anyways, so when we're talking about the eccentric contracting, that's what happens also with that muscles limiting range of motion. So when I do swing my leg forward, the hamstring's being stretched, but it's eccentrically contracting to pull on that, and that's how you can get some of that injury there. But then when we're talking about the training down here under the muscles eccentrically contracting section right here, what we're saying is that sometimes in the gym or something like that, or a coach may say that we're going to do eccentric training. So instead of focusing on the concentric bicep curl, what you'll focus on is just releasing that into that eccentric muscle action all the way down and really focus on that. So when you do that, you have to realize that muscles remain weaker and they remain sore for a longer time period after eccentric exercise. So that force output from that muscle is going to be decreased for a longer period than if you would have worked that muscle concentrically or isometrically. Okay. Also, your rest can have a factor in influence on how long after those eccentric exercises your muscles actually remain weak. So not just like, oh, I feel weak. They are physically weak, and that's up to 1 to 2 days after that. So if you have a hard eccentric training program that's happening, you're going to need to be mindful of your patient or the athlete that you're working with, because up to 2 days after, they're going to have a decreased amount of strength. So you wouldn't want to have a very explosive plyometric exercise day planned after an eccentric training program, because what's going to happen is they're going to have a weaker muscle. They're not going to be able to create as much force. Thus, they're going to have more compensations, and thus put them at a larger risk of actually injuring themselves further. So a lot of times that muscle soreness after exercise is attributed to connective tissue versus the muscle fibers. So the sheaths, the epimysium, the paramysium, the endomysium, the tendons, and the ligaments are actually where they start getting sore, not so much the muscle belly, because you got to think the muscle belly itself has a lot of blood flow, whereas these connective tissues don't have very good blood flow. So when you get these traumas and pulling on them and tearing them, micro tears in them, they take a little bit longer to heal, and they don't heal as well because they don't have that blood flow. So then your chance of injury also increases with fatigue. So this kind of goes back to here, how we were talking about the muscles eccentrically contracting and short rest, longer weakness for days after. So your chance of injury increases with fatigue. That's why a lot of times at the end of games or at the end of a lift, there was where you start to see some of these injuries occur. And that's because what happens is the neuromuscular system starts to lose its control of the actual muscle fibers. So it can't recruit as many muscle fiber or motor units to maintain a muscle fiber contraction, and that leads to altered mechanics. So instead of throwing a ball or running how I should have
At the end, as those muscles start to fatigue, what happens is I start to get a little lazy, my arm starts to fall, my running form gets a little weak, my lifting form gets a little out of whack, and now I'm unstable, and that force is moving through my body in ways that it was not designed to do. And this can happen at the beginning of an activity as well if you're still weak from a previous session. So that's going back here to that short rest equals a longer muscle weakness duration after eccentric workouts, right? But even with concentric workouts, you just have to be mindful that if I went hard the day before, I need to be thinking about what I'm going to do the 2 days after that, because I could still have weakness and my muscles may not be able to put out the same amount of force as they would if they were healthy. And that would lead to more of these compensatory actions as a result of the previous injury. Okay, so as I get weak, I can't do it, I create a compensatory movement pattern, which, or if I was actually injured, let's say I caused a small tear in my bicep, then I go to do something else. Whenever I use my bicep, I have to use a compensatory pattern to perform that movement. Sorry, I didn't know what just happened there. It went away. There we go. So I have to do that compensatory movement to do the action that my injured muscle does, and that can lead to some issues as well. So prevention, when we look at preventing injuries, what we're looking to do is where you want to condition the connective tissue, okay? Because a lot of times when you get hurt, it's not actually in the muscle belly. A lot of times it's at the musculotendinous junction, so where that muscle fiber starts to um, gain more collagen fibers and starts to turn into a tendon or a ligament. And that's where you start to get these injuries. But connective tissue strengthens at a different rate than muscle tissue, so you need to be mindful of that, especially at the beginning. That's why you see a lot of these people who do steroids. What happens is their muscle just snaps off the bone, because if they're increasing force at such a high rate of these muscle fibers, the connective tissue actually doesn't maintain the same level of growth, and so you end up ripping it right at the tendon where it attaches to the bone, because that becomes the weakest link. So when you do that, you want to remember that you want to do a low load for high reps for 3 to 4 weeks as you start changing your training patterns, so that you can give that connective tissue a little bit of time to catch up. And when you look at that endurance training, what that does to tissue, like connective tissue, is it increases its size and its tensile strength. So you're doing a long load, sustained load, not heavy, over a long time. That's going to go ahead and increase the size and the tensile strength of those connective tissues. So you think of something as sprinting, which is high force, very quickly into a specific area. That's going to improve the weight and the thickness of connective tissue. And then lastly, when we're looking at heavy loading, what that's going to do is strengthen the sheets of the muscle fibers, and that's going to increase the collagen. So that's going to help increase all that thickness and how sturdy. And that's how, when they're like, get hard, man, yeah. That's what they're talking about. That's what gives that muscle that firm feeling, is those increased collagen within the connective tissues. So that is not all I had. I thought it was. So inactivity and muscle, what happens is this: when you're inactive or you're immobilized, the muscle starts to atrophy or it starts to shrink. And what happens most, or when that happens most, is during the first few weeks of immobilization.